Hello, this is Dr. Jawad. Please subscribe to my channel for more up-to-date videos, and thanks for watching. Hello everyone, this is Dr. Jawad. In this short video, I'm going to talk about a medication that is very widely distributed, and those are statins. Now, statin medications, the function of a statin medication is to block the enzyme that actually makes cholesterol. Now, what happens when you go to your medical doctor, they put you on the medication and they say, okay, this is going to help prevent a heart attack. Actually, research has proven that cholesterol drugs, statin drugs, doesn't decrease the chance of having a heart attack, it actually increases it. Now, how they hook you is that they say, okay, so now that you're on it, you have to be on it forever, or else you may get a heart attack. However, cholesterol is very beneficial. We make cholesterol in the liver, and what happens is if we actually take in less cholesterol, our body, due to negative feedback loop, actually increases its production of it. So if we actually have taken a little bit more cholesterol from our diet, our body says, okay, you're taking in enough, so I'm actually going to produce less. But on the average, we produce about 3,000 milligrams daily. Now, cholesterol, multifactorial, very beneficial. One, it's a precursor for hormones. It's a precursor for the hormones testosterone, estrogen, progesterone, cortisol, norepinephrine, aldosterone. Cholesterol is needed for a precursor to make those hormones. Also, too, our cell membranes. Our cell membranes are made from cholesterol. Now, we have what's called low-density lipoproteins. That's deemed the bad cholesterol. Actually, cholesterol is very beneficial because the low-density lipoproteins, those are our first responders. So what happens if you get inflammation in the arterial system due to fill in the blank? The body sends a signal to the liver to shunt out what's called low-density lipoproteins. Now, low-density lipoproteins goes there and patch up the hole. So it patches up. Okay, so that's the first responder. Then we have what's called high-density lipoproteins, and their responsibility is actually to clean up the patch to bring it back to the liver for recycling. So there's not really a bad cholesterol or a good cholesterol. It's really one cholesterol but different function. Also, too, your brain and central nervous system are made from cholesterol. Also, too, bile salts. Bile salts. Bile is produced in the liver, stored and concentrated in the gallbladder by 20 times. Now, again, that's made by cholesterol. Okay, and the function of bile is to help break down the fats for absorption of the vitamins A, D, E, and K, the fat-soluble vitamins. Also, too, one of the functions of bile is to help lubricate the digestive system, so you don't get constipation. Also, too, vitamin D. When you go out in the sun and you want to get your blast of vitamin D, it cannot be synthesized without the production of cholesterol. So you can see cholesterol has many benefits, has more benefits than bad. The problem is, what happens when you take a statin medication? The number one factor when you take a statin medication, it depletes what's called coenzyme CoQ10. Now, coenzyme CoQ10, we need that for muscle function. Okay, that's a different video altogether. But coenzyme CoQ10 is needed for muscle function. So what happens with the body over time, it depletes it. So this is where it leads into muscle damage. Again, the most common complaint that I get as a doctor from my patients who are on statin medications is that they have extreme muscle fatigue, extreme muscle weakness, and their body aches all over. So the most common complaint is muscle damage due to the depletion of coenzyme CoQ10. Also, too, nerve damage. Okay, since the nervous system, the brain and central nervous system, is made predominantly from cholesterol. When you are taking a statin medication, you're depleting that. So nerve damage, this is where you get mental confusion. This is where you get memory loss. This is where you get cognitive dysfunction. This is where my patients come in and say, I feel like I'm old. I can't remember anything. Also, too, liver damage. Now, liver damage, the statin medications play havoc on the liver. So what they do is they want to go and they want to check your liver enzymes because it causes extensive liver damage. So when you go to the doctor and they're doing the blood work, they're not only checking the cholesterol levels because they know it's working because you're on a statin. What they're looking at is how much damage it's causing to the liver. Also, too, the endocrine system. Okay, this is your hormonal system. Okay, this also, again, taking a statin medication increases the chance of type 2 diabetes. So this is where what I experience in my practice is that patients come in, first they're on a statin, okay, then because they have muscle damage, they have muscle weakness all over, then they get an antidepressant, and then over the long-term effects, what they have, but now they're on metformin because they're a type 2 diabetic. Okay, all from the use of statins because, again, the cascade. Also, too, heart damage. Now they're on a heart medication. How does that happen when cholesterol medication is supposed to decrease heart attacks? Well, the thing about statin drugs is that it inhibits the synthesis of vitamin K2. Now, vitamin K2, when we take in calcium, we take in vitamin D3 is necessary to pull calcium into the blood. And then vitamin K2 is needed to actually escort the calcium from the blood into the bones and teeth where it should go. So if you're K2 depleted, what happens, this is where you get plaque buildup in the arterial system, and this is how you increase the chances for heart attacks or heart damage. Now the long-term effects are different with males and females, but they can overlay. For males, because what it does, again, cholesterol is needed for hormone synthesis. For males, over long-term use, it depletes the function of testosterone. This is where males just don't have their get up and go in every way, shape, and form. A lot of times the males will complain about low libido, or they just don't feel like doing anything because it's, again, low testosterone. Cholesterol is needed for hormones. Also, too, loss of muscle mass. They're working out or they're exercising and they can't gain any muscle mass. Why? Because it depletes CoQ10. CoQ10 is needed for muscle function. Also, too, decreased cognitive function. They're not as keen, as smart as they used to be. Why? Because the brain, it affects the brain. The nervous system is cholesterol based. Also, too, decreased energy and adrenal function. The adrenal glands, those are hormones. In order for the adrenal glands to work properly, they need cholesterol. Again, when you're depleting your body of cholesterol, you're depleting your body of the adrenal gland function. Cortisol skyrockets. Also, too, a weak immune system. Now, females, again, they can overlay, but with females, again, females weaken brittle bones. Why? Because vitamin D. Vitamin D cannot be synthesized without cholesterol. So if you're taking a statin medication, you're actually increasing the chances of getting weak and brittle bones. However, estrogen is needed for calcium, phosphorus absorption into the bones. So this is where females on statin medications will eventually get weak and brittle bones. Also, too, slow carbon fat metabolism. Females gain weight. Muscle fatigue, again, depletes CoQ10. Same with the males. Muscle fatigue, overall muscle fatigue. Collagen synthesis and aging. Okay, what happens is that it zaps the body. For females, it zaps the collagen. Collagen is needed for tissue repair. Also, too, hormonal and emotional issues. Remember, cholesterol is needed for estrogen, for progesterone function, for all the female hormones. Now, again, if you deplete that from happening, this is where a lot of females get hormone dysfunction. This is where they get emotional situations because, again, the brain, it needs cholesterol to function. So then how do you fix all this stuff without going on a statin medication? Okay, so what can you do if you want to get off the statin medication or if you're in fear that your cholesterol numbers are elevating? First and foremost, I always tell my patients this: I am not your primary doctor. If you want to get the statin medications, you must talk with your primary doctor and work it out with that individual on how to get off the statin medications. However, with the goal, your major goal in mind is to decrease your sugar. Sugar causes the arterial inflammation. When you have arterial inflammation, it's the low-density lipoproteins that actually go and they're first responders. So that's the Band-Aid. And that's what elevates. So the main goal is, again, if you want to decrease inflammation, decrease the sugar, and also to manage stress, because stress will cause arterial inflammation as well. So that's another keynote that I always talk to my patients about. So the goal is decrease sugar, decrease the grains. Exercise. When you exercise, you're going to decrease systemic inflammation with the body because you're going to increase endorphins. Also, too, vegetable oil. If you're cooking with vegetable oil, I understand it's less costly. However, it is causing a lot of systemic damage. So you want to switch to a more conventional olive oil, coconut oil, butter. Now, butter, as long as it's grass-fed butter and not like the trans fats butter. Now supplements, omega-3 fish oils. Omega-3 fish oils will help lower the bad cholesterol. It helps with tissue repair, helps with your brain, it helps with your skin, it helps with joints. Overall, 1,000 milligrams to 2,000 milligrams minimal. CoQ10. CoQ10 is good for muscle. Okay, it's what helps supply the muscles with energy. I always recommend anywhere between 200 to 400 milligrams per day. Niacin. Niacin, again, you want to take anywhere from about 1,500 milligrams of B3, which is niacin, per day. The niacin, now you want to get the flush kind. Okay, so a lot of patients, there's a flush kind and there's no flush. You want to get the one that makes you flush. Now, I always tell my patients, yes, you're going to get flushed out. However, to stay at it, your body will adapt to it. Now, again, you don't want to stay on niacin 1,500 milligrams as a maintenance dosage, but what you want to do, you just want to maintain it for about 30 days and then break down from there. Yet, red yeast rice, perfect alternative. Okay, perfect alternative to a statin drug. Red yeast rice is an herbal statin. However, because it has statin qualities, you may still experience some statin side effects. So again, if you just want to make the switch over from a prescription to a red yeast rice, this is something that I tell them to bring forth to the medical professional and let that person know there is an option. Again, 1,200 milligrams twice daily. Again, you don't want to stay on this forever, okay, because you will still get the side effects from the statin medication because it is an herbal statin. So again, here's statin medications. Hope you enjoyed the video. Please share with a friend. I'll see you in the next video. Take care.